Thank you so much for this opportunity. My name is Emmanuel Kaindoa, and I work for Ifakara Earth Institute in Tanzania. Today, I'm going to share briefly with you one of the key findings for my PhD study, which was on housing gaps, mosquitoes, and public viewpoint, a mixed method assessment of the relationship between house characteristics and malaria transmission in Tanzania. This study was funded by the Consortium for Advanced Research Training in Africa, CARTA. So there have been multiple evidence suggesting that housing characteristics do influence malaria transmission in many African settings. Also, further evidence suggests that malaria transmission, indeed, most of the transmission occur indoors comparing to outdoors. So we did a study in Tanzania to quantify this relationship of malaria transmission in the country, but again, as well as understanding how the community members cope with the situation. How do the community members understand about the risk that is involved in those kind of houses? So this study was done in southeast part of the country, where malaria transmission is quite high in Tanzania, to characterize the houses and establish the evidence of the relationship between mosquito biting risk, malaria transmission, and housing characteristics. So most of the houses in the country poorly finished with gaps on the eaves, walls, and windows, as well as unscreened doors and windows. So these are one of the features, risk factors for malaria transmission in multiple settings. So this study involved a mixed method study design, which had 4 components: quantitative data collection, observation, questionnaire, as well as focus group discussion. So for the quantitative data collection, this involved a full year of entomological survey in selected houses, just to collect the number of mosquitoes in different kind of houses and assess the indoor mosquito density. We did the observation of the houses to understand and quantify the eaves, walls, the nature of roofs, windows, doors, as well as temperature and humidity. We also counted the number of occupants in the house as one of the key factors for malaria transmission. We also characterized the surrounding environment of the houses, which included water bodies, vegetation, toilets, cow sheds, and animals. So all these were characterized and correlated with the number of mosquitoes. So for the questionnaire, we administered a questionnaire to the household heads just to understand if the community members have knowledge on malaria transmission, as well as the risks of them using those kind of houses. The focus group discussion was also done to explore the opinions of community members on housing design and malaria transmission in the country. What we have found is that most of the houses had open eaves, unscreened windows, iron glass roofs, and open doors. So in this study, we found that more than 50% of the houses had mud walls, and 74% had open eaves, and more than 60% had untighted doors. So all these factors do influence the vector densities. With regard to the community members on the knowledge of these factors and malaria transmission, we have identified that the community understand the risk that is involved, but they frequently mentioned that financial constraints were the key as to why they have poor houses in the country. So going forward with malaria control and elimination in the country, we propose that housing modification should be integrated in the vector control. Because the community members are aware of the risk of houses characteristics and malaria transmission, so we think that integrating the knowledge and developing a simple, affordable, and scalable house modification interventions could indeed reduce the transmission and achieve the target of eliminating malaria in Tanzania by 2030. So such technology should be affordable, suitable for all houses, regardless of the house designs and construction materials. This study, as I mentioned, was funded by the Consortium for Advanced Research in Africa and Wellcome Trust, CEDA, and the other collaborators, as I mentioned in this slide. Thank you so much.